Health meeting for the City of De Pere. The day is Monday, May 12th, 2025. It is 5:20 right now. We had a little glitch getting things started at 5:15, but now we have that taken care of. So let's do ourselves the first thing, agenda item, which is roll call. First person, Pamela Gatz.
Here.
Here.
Oh, that's loud.
Devin Perlock, not here yet. Terry Gulyas.
Here.
Okay. Robin Lawrenson.
Here.
Here. And Dennis Hibray here. We also have here as well Health Officer Crystal Waller.
Here.
And also Sarah Lawrenson, Assistant Health Officer, Deputy Health Officer. There we go.
Here.
Okay. And in the audience, we have two people as well. Chris, would you like to introduce yourself?
Sure. I'm Chris Colada with the Wisconsin Department of Health Services, Division of Public Health. I'm the Northeast Region Director.
Okay. And the other lady?
I'm Katie Wiesner. I'm the intern for the Health Department this summer.
Well, great, Katie. Glad you could join us tonight.
Nice.
This part of your assignment tonight to show up here? Or are you explaining things? Okay. Okay. Roll call has been done. Public comments on the matter. During the public comments. Now, is this the time that we want to do the 140, or is this going to wait till the 140?
We'll wait for that agenda
Okay.
item, I think.
Well, nobody here for public comments. Okay, number 3, approval of the May 12th, 2025 meeting minutes.
I'll make
Have a motion?
to approve.
Okay, have a second?
A second.
Okay, discussion. Any discussion on the minutes that we took? You know, Kelly does such a nice job doing this. You know, nice to have a tape recorder that gets everything that we say. Okay. Any discussion? Hearing none. All in favor to accept the minutes, say aye.
Aye.
Opposed? Motion passes. Okay. Board of Health membership discussion, reappointment of Terry Gulyas and resignation of Dennis Hibray. Yes, I'm leaving. I am.
We're not approving that one. Sorry.
Well, you have yourself 4 months left of me, maybe at the most. You know? No, Terry, I understand you signed up and we decided to extend things, which is fantastic.
Wonderful.
And I came and talked to Crystal, and I had the letter as well, and I thought, you know, I've been doing public health now for 50 years. Started January 2nd, when was it? 75.
Yes.
And this makes it 50 plus years, I guess, doing this stuff. And I said, I think I've had enough public health right now. So I said, it's time to get new blood in here as well. So I've enjoyed it. I've enjoyed the board members. I've enjoyed the health officers, the staff, the whole thing like that. But it's time to do other things as well. So I'm not going to be running anymore for that. So hopefully we get ourselves somebody new, brand new in here to do a terrific job that has some public health experience, or maybe not. Who knows? We'll see what happens.
Yeah.
And nobody else lined up, right?
Yes, Mayor will definitely work on
Okay.
that. And if anyone has any suggestions, you can get that to Mayor. But really want, of course, to thank Dennis for his commitment to public health, the profession, and to us, you know, in De Pere. Just 50 years. Wow. I mean, you started when you were 2.
I know I did. I retired when I was 10, you know.
But thank you.
Yeah.
And we'll definitely celebrate in November your last meeting.
Am I going to be around in November? Probably will be,
I hope
yes.
so. I hope so.
Okay, going on number 5, discussion of the results of the 2025 Department of Public Services Chapter 140 review.
Thank you. Yes, if you can move up and then just make sure the microphone is on. I just want to thank Chris Culata for being here tonight. Appreciate his time and support.
I laugh about coming, the Northeast region that I represent as the Northeast Region Director is 17 counties, 19 local health departments, and 3 tribes. I live very close to this one, so 4-minute commute is really troubling. So no, I'm happy to be here. I know it's not on topic, but Dennis was the first regional director for DPH, and I'm the second. And so because he's hung around so long, I have to keep working longer to continue.
You know, I had 34 health departments when I started, back then, so it was a lot, but it was fun.
Yeah. So just a little bit of history. Back before Crystal became the health officer the second time, we did a 140 review as a level 2. So we have 3 levels of health department in the state of Wisconsin. That was November of 2023. After that, we had a conversation after Crystal became the health officer in 2024 with Sarah, and we talked all kinds of strategy things. What are things we could look at? Where could we position things? What would it take to become a level 3? And so I know sometimes level 3 in the past meant one thing, but there was an administrative rule change in about 2019, and it clarified some things. And what I mean by that, in the past, it was just arbitrary numbers. A level 2 was 7 programs or services. A level 3 was 14. Well, who picked that? I don't think there's a good answer who picked that. So anyways, they did this rule revision. They worked with a lot of health departments and health officers, and they got different feedback. So now there's the opportunity for level 3. And so Crystal and Sarah did their due diligence. They went to the city administrator, Larry Delo, at the time and said, hey, we're looking at this opportunity. We want to become a level 3. Most agencies around you are level 3. I think about Brown County or Sheboygan, Manitowoc, Menasha, Winnebago. I'm probably missing a whole bunch, but there's a few level 2s around. But in this area, it's mostly level 3. I will say it's not one level's better than another level. It's just that they offer different services for their constituents. So we came out on April 14th of 2025, and we did the level 3 review. And basically, Dennis, it was great you were there as the chair. I believe your new city manager was there also, and that's always helpful. And so we basically ran through some things, and it was probably a little less than 3 hours. I thought it could have been done a little quicker, but I wasn't running the review, so I'll just say that. So
I don't know, it seemed like 5 hours to me, I guess.
Well, it's a great opportunity. Basically, we have 84 health departments in the state of Wisconsin. And if you see one health department, you've seen one health department. They're all different. They have different board structures, or some are health and human service, and some are municipal, and some are merged agencies. So I appreciate working with all of them, but they're all different. And I don't treat one like the other because they're not the same. I mean, there's some ways they all get grant dollars, or we treat them certain ways fairly, but they all have their unique specialties. So we highlighted some strengths or best practices. And so one of them is partnerships. And so this health department has done a phenomenal job partnering with all kinds of different, it can range from nonprofit to other government agencies. I mean, thinking about your environmental health, you have an agreement with Menasha, and you cover and you support each other. And so that's just phenomenal leadership around partnerships. The other thing is the use of data. And so we were really impressed. I know, Crystal, when you were the health officer the first time, way back in 2013 and 2016, and yes, I was here during those times, you struggled with data for DPMC. And so you guys working on your dashboards and being able to say, this is our municipal data, because there's all these gaps with zip code, because then you're getting Rockland or different areas in there. And so that's been very impressive, just to say, let's relook at data. I think way back when Heidi Selberg, and we had the trouble with dental data,
Right.
and oral health people going into emergency rooms, and we struggled with that. And so I think you guys are in a much better place than you were back in 2014, 2015 with data.
Right.
Another is performance management and quality improvement. You guys, number one, you took on the pilot for working with results-based accountability. And I'm not going to answer, I guess, Crystal and Sarah, how do you think your performance management has grown since you've taken on that pilot?
Well, I think, it's helped our community health needs assessment, our community health improvement planning process that we collaborate with Brown County on, as well as just informs our performance management dashboard that we present to all of you each quarter. It's really informed that process and how we choose quality improvement projects based on what we're seeing on the dashboard. Some of the data points are just monitoring, right, what's going on, but some, it will come about that, I think our response time could be better. Is there anything that we could do to improve our response time? Or as mentioned before, like monitoring Trista and that environmental health inspection program, is she over capacity? For the establishments to kind of say, okay, maybe it's time that we offload some work, or at a point maybe look at adding a position. We're not at that point yet, but it's really allowed us to look at our internal department operations to see, okay, where should we focus our efforts to improve different things? So I think we've come a long way, and it is a pilot. You know, Sarah and I sat down when I first started, and it's like, what could we do? And seeing some examples from other counties, Pierce County, you know, seeing how other health departments do it has really informed us and our work, and it's still, that in itself is a quality improvement project within itself. We just said that last week. So I think we've come a long way, and I think we still have work to do, but it's a good start.
Thank you, Crystal. See, you live it more than I do, so I can see it. So then we identified 2 opportunities for the future. And so one is land use planning. And I know I've talked to Larry in the past and other, Debbie Armbruster when she was here, about a lot of times we talk about, I should just say I'm a recovering transportation planner. I worked for DOT for 15 years. We talk about CHAS and CHIPs, community health assessments and community health improvement plans, and that's fine. That's a 3 to 5 year process. Your city comprehensive plan or your comprehensive outdoor recreation plan for parks or other housing plans that you do in the city, that's really the place where you can say, where's the impact on our population for health? And so I think that's an area. It's great to mess around with 3 and 5 year plans, but if there's 20-year horizon plans, there should at least be an aspect of health thought about, because we often think about the physical environment. We don't think about the people that live in the community. And so that's just something I'm glad DePere's willing to consider it in the future when you do update that plan.
Yep.
The other thing, Crystal already hit on it, assess staff capacity. You're small and mighty and you guys do many things for the community, but you could burn yourselves out. I mean, depending on if you're doing too much, I think you do have a lot of agreements and partners, but those were the 2 areas that we identified. So normally we have 3 areas, we couldn't come up with a 3rd growth opportunity. And then I just want to touch on some of the things that we looked at from level 3. So we looked at like community health strategists. How is the health department thinking about the health as a strategist, not necessarily a doer? I mean, there's a time and a place when there's gap filling, and there's another time and a place where there's assurance. And so I go back and forth in my mind. I think about, there are parts of Wisconsin that are very rural. They have no hospitals. They might need to provide gap services because there's no one else providing those services. In Brown County and the city of De Pere, we have 4 or 5 hospitals and more being added all the time. And so there's places where an assurance role might be more appropriate. Is there others in the community that can provide the services, and then public health is the strategist and not the doer? Now there's other areas, there's gaps, you're the doer. And so there's that constant evaluation of what's needed in the community and who's in place to provide that service. And then just some of the other areas that we looked at environmental health, and then we talked about workforce development and some other topics. So all in all, it was a great review. Hopefully, Crystal and Sarah, it wasn't stressful to do the level 3 review. I mean, we have changed this process. Dennis probably remembers in the past, the whole cart would come in and we'd review all these documents. Now it's more of a conversation, and we're making an assumption that the health department is doing great work. Sometimes we're proved wrong, but in most cases, we're not proved wrong and they meet their level. So with that, and I'd be happy to take any questions at the end, but I have a certificate of designation from the Wisconsin Department of Health Services to the De Pere Health Department, is a local health department in good standing with statutes set forth by the Wisconsin legislature and relevant administrative rules of the department. This local health department was formally reviewed by the Wisconsin Department of Health Services Division of Public Health on Monday, April 14th, 2025. It has been determined that this local health department meets the requirements and so is designated as a level 3. In accordance with DHS 14008, this designation is in force up to 5 years, and it was signed by Paula Tran as the state health officer.
Thank you. Thank you, Chris. Awesome. And Sarah, I want to extend, as the memo said, a special thank you to the administration here at the city for their support, and they've always been so supportive of the health department, even in my first term and long before that. And of course, Deputy Health Officer Sarah Lawrenson, the planning that goes into that and the framework that we've set together for future reviews was a lot of work. And thank you also to not this graduate student, although she has helped with a lot of the implementation of different aspects with our data, but our previous graduate intern, Alyssa, helped, or Allie, helped with that. She was our MSU student. So again, thank you to Sarah, thank you to the whole staff team who aren't here tonight, but really did great with presenting all of that. So thank you
Well,
all.
Crystal, it's
And the
quite
Board
an
of
honor.
Health members.
Crystal.
Board of Health support, yes.
You know, back when I was doing Chris's job, I looked at DePere, and we had other agencies as well, Menasha, DePere, a number of small ones, and I never thought DePere would become a level 3. I didn't know, I had a tough time imagining it becoming a level 2.
Sure.
And, but you did it. You
Well,
came around with your staff, with the programs, with the skills you've got, to you and Deb Armbruster, who got things going as well, and Crystal before that time. It's something that I guess I never realized would happen in DePere because of it's a lot of it is based upon the size of the health department. And I mean, DePere doesn't have a large health department, but you do a heck of a lot of programs. And that's what the number is really it's a thing of proving that programs are good, that they are accountable, and you can get those done. So now the hard part's going to be continuing that
Right.
type of thing.
Sustaining.
Yeah, so.
Yeah.
So you make me proud.
So now he can retire.
Yeah, now I can retire, yes, right. Do I have to think about, are there going to be a 2 or a 3 now, or yes or no?
Well,
Thank you, and
all.
thank you, Chris,
Thank
for
you.
coming.
I'll leave this here. I'll
Thank
stay
you,
for a few
Chris.
minutes for and listen to a few more agenda.
Sure.
Okay.
Thank you, Chris. Thank you, Chris.
Okay, number 6, discussion of the draft 2026 Health Department expense review budget and narrative. Crystal, that falls in your lap right
Sure.
now for a little bit.
Yes, that's great. So just a reminder for maybe Robin, especially being new, just to let you know how this works. So the Board of Health, we always like to put a draft budget in front of the Board of Health so you can see our expenses and our narrative. And then what happens is we work with city administration to kind of revise and where they see is needed according to the overall city budget. And then the process is that it goes to the finance committee for approval, and then it goes to city council. So the Board of Health definitely has input, but there is a formal process within the city that Pam's well aware of, as being part of the city council, that there's an approval process for this budget. So feedback is welcome. I still have a chance to make any revisions that you all see as needed, because I don't meet with Kim and Pam until I think the end of the week or even next week. So so really our mission is embedded. We have program standards. I do cite the different programs as well as the foundational services according to the Public Health Accrediting Board, and that I changed up a little bit when I came back because I think we still had the essential services, which was good too. It's just I didn't elaborate too much on essential services, wanted to kind of incorporate the Public Health Accrediting Board foundational services. So all of that narrative gives context to the numbers. The city does ask us to create performance measures and to report out on performance measures from last cycle. And so you'll see in here there's immunization standards as far as our percentage of up to date, as well as our expectations with food establishment inspections. So those, are the primary ones we report out on. There's also communicable disease. We have an expectation, right, in accordance with state statute, that we follow up in a timely fashion, depending on the disease, within 72 hours, sometimes for a Category 1. But so those are all embedded in these program and performance standards. Then the city also likes that we highlight some achievements in this last cycle. And so, of course, we highlighted the fact that we did level up to a level 3. Now, it does allow for a formula change with state grants. And so we will see possibly a little bump up. It's nothing significant. I think for prevention, we're so grateful. It was about 500 or 600 that we saw an increase because of this level 3 designation. There are some contracts passed through from the federal government to the state government that they don't incorporate the level status, one of those being the preparedness grant. So we won't see, in fact, in this budget, we're seeing a decrease in that grant, again, passed through from the federal government, about a 28% decrease. So that is incorporated in the numbers. So I just wanted to highlight that to let you know that being a level 3 is a great recognition and proves, for all the hard work that all the staff do, but also there is a tiny monetary incentive for becoming a level 3. Our community health improvement plan, again, collaboratively with Brown County, that was released in 2025. Our connectedness, community engagement, I wanted to highlight for city council and finance, just to let them know that there's a lot of great work because of the grant funding we received from the federal government to the state government to us. So highlighting that, I would say then that last section of the narrative just talks about the differences. So whenever there's a more than 5% increase or decrease, city administration likes that, and city council likes that we explain that in the in that narrative. So you'll see salaries increased, hourly wages increased. There was some FICA benefit increase. We are, for the first time, and I will highlight this, typically we haven't had budgeted in tax levy to pay for licensure. So in this budget, we did incorporate, when it's due for RN licensure and or sanitarian licensure, that it be covered by tax levy. And we kind of align that with other departments within the city. So that is something new for the health department. I highlighted the MCH grant and the immunization grant because we don't know what those allocations are yet. And so I'm just basing my numbers on last year. So I just wanted to highlight that for you all, so you see that that might change as we go through the process, just because we don't have that notification yet. But what we do know, again, is that the preparedness grant decreased about 28%, which was about $9,830. So you'll see the city's numbers then in the next attachment, and also then our projected revenue. Now, our revenue for the health department is part of the overall city revenue. So we don't have that separated out for just health department revenue. It's part of the city's revenue, right? So that's why you'll see all those other revenue line items within the budget without any numbers in it, because we have to wait for the process to happen for the whole city government. I just did the health department portion of it. So I'm not expecting any increase in revenue from, our programs or services, our licensure, unless I hear from the finance director that as a city, we need to increase our licenses like a 5% increase. I haven't heard that yet, but just know that that might be a change. And we would go along with the recommendation from administration on that. So that's the health department budget in a nutshell. I do like to highlight in the narrative, and I put this, I saw Debbie, I think, kept it in there, is the percentage of tax levy versus revenue and grants for the health department. So you'll see in the 2026 health department total program cost is $764,108. The local tax levy portion of the budget is projected at $549,590, with $214,518 being funded by grants and program revenue. So just for that perspective, about 72% tax levy, 28% revenue and grants. So I just like to be real transparent about that. And a reminder that it's estimated that every dollar spent on community prevention saves $5.60. Investing early and wisely in prevention is a good return on investment, right? So that's the budget. Any questions or feedback or
Any
comments?
questions for Crystal?
Nice presentation, Crystal.
Yeah.
You're not receiving any more COVID dollars anymore. Those are zeroed out now.
At the end of December 31st,
Okay.
the ARPA dollars will end for us. I think there was an extension again. However, ours will be expended by the end of December.
What was the maximum amount of COVID dollars that DePere received? You
A
have
lot.
that? Yeah?
I don't
A lot,
have it,
Okay.
but
It's
it
several
was
$100,000
significant.
a
Yes.
time, wasn't it? Okay.
yes. And I know Debbie before me had season or LTE staff. A large portion of those funds went to additional staff to support the operations of the health department during the COVID response. So it was isolation, quarantine, contact tracing. Yeah.
And I think the biggest unknown at this time is really what's going to be happening
Right.
with the federal budget and how that's going to be funneled down. We don't know what that's going to be yet, and but I'm sure you have nobody has an idea, I guess, at this time, but you have a plan in place what's going to happen maybe if we start getting cuts, and that's an unknown.
That's
So
an unknown, right?
we'll have to deal with it when that happens, I
That's
guess,
right.
if that happens.
Right.
Okay. Any questions from Debbie? You're on the budget, okay. That is basically just an overview, and that's going to be, what's the next process going to be now? It goes before the city council?
It goes before administration, so finance director and city manager, and then we'll have a discussion.
Okay.
And then after that, it goes to finance and then city council with lots of feedback in between.
Do we need a motion on this to approve it all, or just accept it as it is?
I was going to ask, Crystal, do you need any of us to show up to support your budget?
You're always willing to be there. I really, because our increase is less than 5%, I can't imagine at this point in time, unless something out of left field happens, like Dennis said with federal pass-through, and I'll keep you informed, but thank
Yeah,
you for
please
the
let us know.
ask. But at this point, I think, with our budget as written, with only a 1% increase,
Yeah.
we should.
Well, just say discussion, so I think we,
Yeah, I
any
don't think
discussion, we don't need a
yeah.
motion on this
Yeah,
yet, because it
she's
isn't
just
final by
presenting
any
it,
means.
so I don't think we need to vote on it.
Okay. Thank you, Crystal, for such a thorough overview of
Yeah.
the budget then. Okay.
Good job.
Now comes the discussion of the draft Board of Health budget narrative. Number
Right.
7, okay.
So just like the health department, the Board of Health also has a budget. Now it's $100. So
Gonna
if
break
you
the
all,
bank, isn't it?
if
Yes.
you all would want to take a look at that, it's been like that for years and years. If at any point you would like me to ask for additional funds, I would be more than willing to. Really, a lot of our conferences or professional development, that's all online. It's a webinar, and it's no charge. And so if that changes at any point, but at this time, I presented it as it was in last budget cycle at $100, and then narrative that goes along with that. Basically, that you would pass at least one policy forward to city council as it relates to public health, and then just maintaining public health services within the city limits of De Pere.
And I think that $100 helps pay for the lunch for the
Sometimes.
city
I mean, if
council
you
member
think-
to come, Board of Health member to go to Waldown.
Yeah.
Okay.
If you think you need more down the road, you can always request that too.
Okay.
Right, so,
Yeah.
yeah.
Yeah, like if you ever, I mean, one of the things Debbie mentioned to me is if we ever wanted to go to a conference that isn't funded, something like that.
Sure.
Would be, but everything I found is free, so.
Right, a lot of it is, yes. But if there is anything, to Terry's point, just communicate that to any one of us, myself or Sarah, and we'll be sure to have that covered.
Any other discussion about the Board of Health budget of $100?
Oh, I don't know. That's a tough one. We're gonna have to
Break the bank
sleep
on that
it.
one, couldn't we, I guess, okay. Okay, number 8, consideration and possible action on the DHS Tuberculosis Dispensary.
Yes, so this is an annual contract and is due for signature again this year. It's a very long contract, but the gist of it is this is an agreement with Wisconsin DHS so that any medical service expenses related to tuberculosis would be covered at the rates that they have published within the contract as the payer of last resort. So within the contract too, there's an algorithm, if someone's in the city limits of De Pere and doesn't have Medicaid, doesn't have private insurance, isn't eligible for Medicaid, then this would be the payer of last resort. So this is an annual contract. I call it an insurance for those who would otherwise not be covered. And so, again, since I've been here both terms to date, I have never utilized this or executed, but it is good to have on file in the event we would need it. So again, annual
And this is not
consideration.
new for us at all, this is what you've always had done?
Right.
Okay.
Yep.
It's about 40-something pages long, which I started reading part of it, and I said, no, I'll have Crystal explain it to me instead if there's any questions. Any questions on this? Can I have a motion to approve the tuberculosis dispensary contract?
I make a motion to approve.
Do I hear a second?
A second.
Second? All in favor, or any discussion? Additional discussion, okay?
No.
All in favor, say aye.
Aye.
Opposed? Motion passes, okay.
Thank you.
Okay, next one is consideration, yes, and possible action of the Health and Human Services 690 form and regarding the HSS grants policy.
Okay, so this is something new that the federal government is asking state governments and any subcontractees of state government, which we are, to look at this policy statement that's linked here, and actually it was just revised at the end of July, but is asking that we sign as an entity that we will not discriminate, and we will basically follow the guidance of the federal government to be in compliance with the pass-through funds. And so again, this is a new federal form that we have been asked, because we are a subcontractor of Wisconsin DHS, that we have signed. And the timing of this is anytime we were to enter into a new contract, and now that we have the tuberculosis contract, that we would go ahead and sign this form. So city attorney's office, the legal department has reviewed and has this information in front of them, and knows that we're coming here today for your review and consideration. And then, of course, because a signature needs to be obtained, it will go to city council just like the tuberculosis contract.
Okay.
And the city attorney's okay with it?
Yep,
Okay.
yep, they've seen it.
Okay.
And they've also seen, I passed the revised policy statement that was just released at the end of July. So, yeah.
Okay, good.
This needs a motion and a second, so we have a motion for consideration of possible action on the Health and Human Services 690 form as it relates to grants policy. Can I hear a motion on that? I guess I made a
I'll make a
motion. Can I have a second?
Second.
Okay. Any discussion on
That's
this? You know, it takes a little while sometimes,
We'll
Terry.
just kind of rotate.
I was waiting for somebody else. But,
I'm waiting for Devin to come in the office and start saying, I agree with that, okay. Any other discussion? Not hearing none, all in favor say aye.
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 Anybody opposed? Motion passes, okay. Director's report.
Yeah, so I did dip into the third quarter a little bit just because, this covers the end of July. But different things I wanted to highlight that isn't captured in the program performance dashboard. So Sarah led an initiative the first time ever called the Senior Safety Expo. It was held at the DePere Community Center. And it was a great turnout, a lot of great partners, and I'll maybe pass it to Sarah to give more detail.
So it was a wonderful event. So we had, I want to say, 14 different community partners participate with us at the community center. And from Brown County Emergency Management to our different city departments, our fire department, police department, ADRC. So the whole point of this Senior Safety Expo was really to highlight preparedness and safety for our senior population. So it was really, I think, very well received. We're excited to do this again next year. I mean, some lessons learned. I think better advertising. We advertised on social media, but also like within the community center and on our different TVs throughout and things like that. But I think next time maybe putting something in the paper to just
Put it in the ADRC events
Yes.
calendar.
Yeah.
yes, that would, and even on like Brown County Community Connects. So some lessons learned that way, but it was really great. We had used some grant funds and we put together these preparedness kits that they're like 5-gallon buckets, and inside we had weather radios with solar for so they can charge their phones during a power outage. First aid kit, Bio Life with a lanyard so they could put it around their neck if they needed to leave in a hurry. Garbage bag, masks. We just had everything, and then all kinds of education too within the kit. So they really liked that, and I thought it was really well. It was fun.
It was nice.
So
awesome.
Now that would be, if you could take a picture of the kit and all the things that are in it and have something like that posted on the social media site, that would be nice.
yes,
Put free underneath
yes,
it, you know?
free. Yes. So it's definitely something for next year, like Severe Weather Awareness Week. We do that weather radio giveaway, and we do maybe something around that. Same with that time frame, like having. In Brown County Emergency Management, they have a toolkit for the older population and people with disabilities that they were giving away, and so it was really great.
Very nice.
So-
Yeah, because I didn't hear about it. I would have loved to have gone.
Yeah. So
Um,
you have the
also
lesson. You have
The Seniors for Seniors, have you heard of that organization?
What was it?
Seniors for Seniors?
Oh, I don't know.
I can send you a link
that
that'll
would be
give you
great.
contact information.
Yeah.
So, yeah.
What do they do, Teresa?
They have monthly meetings and I mean, that's something you could even arrange
Absolutely.
later and just to
Yeah.
demonstrate the kit, not to necessarily have all of the vendors and everything there, but yeah, they have monthly meetings on stuff for seniors.
Oh, that's great.
Oh, yeah, I'd like
Welcome.
information on that.
Yeah.
Yeah,
That's great.
sure. I
For
can.
my,
You want that
Fine.
information too, Pam? Sure.
please, thank you.
Good.
You betcha.
So Sarah, a lot of time and effort went into that, organizing that. So thanks for that.
Thank you.
First ever
First
senior
ever.
safety.
That's awesome.
And then our social connectedness work continues. We sponsored a park bench. We worked with our parks department over at Lawton Park. And so you see the picture embedded on the back. It says kindness is contagious, belonging begins here, which is kind of our connectedness tag line. So that was a great project. And then Sarah had led the welcome baby onesies. So for years and years and years, we've been giving resource packets to new babies born in the city limits of De Pere. And this year, for the first time ever, we had grant money to sponsor baby onesies. Again, talking about, our newest citizen, our newest member of our city, belonging begins here. And so, again, with all of the great resources that Sarah compiles for those new families, and then wanted to connect people virtually by hoping that someone would snap a picture in the onesie and share it on social media. And we're still waiting for that. So it's kind of a fun, neat project. The Milk Depot update, Sarah did some press release, two interviews actually. So that's been going great. You can see in there approximately 15 gallons we've collected, and we're just the depot. We're not dispensing. We're just collecting, but getting that down to Illinois for pasteurizing. So that's been a great project. Our injury prevention programming, we did a lot of bike helmet fitting. So beer gardens, bike helmet fitting, and with
Glad
the
you
help.
clarified that, okay.
Yes. And it was so neat to be there and see the sea of kids at the beer gardens, all with their helmets on. So all the way, toddler helmets to, school age helmets. So that was a really neat thing. And we actually just, for National Night Out, going out to different neighborhoods, fitting those same helmets on kids throughout the city limits. So injury prevention programming, that's been really neat. And Sarah and Danielle go and do that same thing at Lambeau Field with the De Pere Police Department. So lots of injury prevention programming, especially these days with those e-bikes and those e-scooters.
They go so fast.
They go so fast. And so...
And some are in the street. And
yeah, right.
Sarah and Crystal stopped at our national night, and Pam did too, at their national night out, and handed out helmets that the kids were thrilled with, and frisbees and
fun.
other things as well. I'm trying to think what else it was.
Sunscreen.
Sunscreen, that's right. She gave that to me.
Surveys, right?
That was really exciting.
Yeah.
It was
That was nice.
well received, in terms of that. And I don't think any of the kids had helmets on when we were biking around or anything, or when they had the skateboards, the powered
Right.
e-skateboards either. So now they had helmets. They thought that was really cool, particularly the orange ones. So
Yeah, right.
so it was
Right.
fun to have
It was
them
fun.
watch their reaction when they received that, and no cost to that as well. So.
Right.
Nice.
Yeah, we didn't get to give you anything. We just ate your ice cream
Yeah,
sundaes.
and
we were
toppings, I know.
A really good ice cream bar.
Yeah, I came after you, Pam, and I found out there was very little ice cream left, I think.
I ate it all.
I know.
Oh, me and Jonathan.
It was a good night
It was
out.
fun.
It was a
It was
decent night out,
perfect.
too.
Yeah.
We love that the fire and police invite us along, and riding on the RV, going out to the neighborhoods is really
I
fun.
think we just missed you. We were
Must have.
driving
Yeah.
one way and you were coming the other.
Other way. Yeah, it was good. And then I just want to provide that general grant update. So again, talking about the 28% decrease, we have had a realignment with some immunization funds, experienced a 50% decrease, and we haven't seen the new amount, but the contract ended early. They asked that we only spend 50% of our total contract. We're waiting for that re-up on the immunization contract. Again, we don't know the amount, and we do know that the state, at least, is providing a one-time, I call it a supplement or a backfill, to make us whole, at least for the next fiscal year. So we'll have to see what that all looks like in years to come, and to Terry's offer, like if we ever need to have some support with that, I'll call upon you, but thank you for the offer. Again, on a positive note, our prevention block grant was increased by $625. And that was because that funding formula changed because we're level 3. The strategic plan, you all are getting emails and invites. We're in that process now. It'll be a 5-year plan. Just a reminder, as our stakeholder, if you haven't filled out our stakeholder survey yet, we would love to have that feedback. So check your email, and maybe check your spam if it landed there. It shouldn't have, but just in case, if you didn't see it, just double check. So that's our strategic planning. And I'll keep this as an agenda item going forward, just so I can update you all on that process. And I think, Terry, thanks to Terry who came that first meeting.
Yes.
I think Dennis plans to come August 18th. Anyone is invited. And if you need those dates again, I can send it your way. I know it's hard, especially when, it's work schedules and things like that. So I appreciate those who can make it. But through the survey, if you could give feedback, if you can't attend in person, that would be wonderful. Sarah went to WellDab in my place. I know, Terry, you like to have this on,
Thank you.
yes,
I look
as
for it.
an update. So WellDab, we have regional WellDab meetings, and Sarah connected in my stead. I was on vacation, and there is information embedded in the director's update on what was presented. And then every month, I do attend the WellDab Board of Directors meeting as the Northeast Region representative. So we just had our last meeting on Friday, and so more to come there. I think that, Sarah, I don't know if you have any highlights other than what's written in the director's report.
I do not. I was kind of in and out because I had some other meetings I had to go attend and then come back on. And
Right. Yeah. She was wearing
so
multiple
I was
hats.
wearing multiple hats that day. So
The next
but yeah, just what was shared.
in there.
Yeah, I think she's telling you that you can't leave anymore.
Right. No more vacations for Kelly. No more vacations for
Yep,
Crystal.
that's it.
But yeah, so our next meeting for WellDab is September 11th. So if anyone's interested, I always send that agenda out as soon as I receive it. If anything looks of interest, you're more than welcome to travel with me and or connect virtually.
That worked well, connecting virtually when I wasn't
Yeah.
able to go with you, but
Yeah.
I'd like to go with you sometime. I think I've got September 11th on the calendar already.
Nice. Okay, sounds good. And then we have our seasonal intern. So Katie Weisner has been with our department since June, and maybe the end of May, and right after the holiday. She graduated from UW-Madison with her master's degree in epidemiology. So for the first time ever, I can say De Pere Health Department has an epidemiologist on staff.
Temporarily, I guess.
Temporarily, we're so excited to have her. She's assisted us with multiple projects, communicable disease analysis, environmental health inspections. She's helping Trista with tourist rooming house inspections, community engagement, all the things. She's getting a wide taste of what a local health department does. So it's been great having her, and plus she's from the De Pere community, and so it's fun. She went to West De Pere High School, and now working here. We'd love to keep her, but I know that's probably not in the cards at this time. But we're trying to get her connected to all the people and all the things.
Very good.
That's good.
I don't know, Katie.
Katie, have you enjoyed it?
Yes, I have.
Is there anything you want to say? Is there anything you want to say to the board?
No, I mean, what Crystal said with getting to experience everything, that's what I really wanted. So I'm really happy with the experience so far. Any question I ever have, I can ask Crystal or Sarah or anyone else anytime. If I want to get involved with something, I just ask and they get me connected. So it's really great.
That's great.
Well, thank you very much for accepting the offers, being a student up here and
Yeah.
working with Crystal and other health department staff as well, so.
We'll keep our fingers crossed that you come back as permanent staff.
That's good.
Thank you.
And then I just, at the end, look forward, mark your calendars for our upcoming health department. It's not all inclusive, but just some of the highlighted events that we have coming up. Not that we have to review each one. So those are just some things on the calendar.
It's amazing what can get done in 3 months. What happens in 3 months' time from our last meeting, isn't
Yeah.
it? Thank you, Crystal and Sarah, very much, and Katie as well. So,
Yes. Very nice director's report.
Communicable disease report.
Yeah, so Danielle submitted this information for you all. Note that the chlamydia numbers did double in Q2. Again, that's April through June. Respiratory illnesses were down. And then just a reminder how the reporting works with COVID hospitalizations, influenza, and RSV. We had a suspect outbreak of pneumonia that was submitted, but it didn't go beyond the 3 cases. So information was provided and the necessary reports were filed. We did have 2 cases of vibriosis, which is a GI condition, usually from eating undercooked shellfish or unsafe food handling, but they weren't connected. So we did investigate and even consulted with the state on that without any connection found. So very unusual, I think, for us. And then we did have a latent TB infection case that actually went through the immigration process and was referred for preventative treatment, but since moved out of state. So that case has been reassigned to the jurisdiction where that person is now residing outside of Wisconsin. So that is all for communicable disease.
I have a question. Yersiniosis. I'm not familiar with that. What is that?
Yersinia. I'd have to look it up, actually.
Okay.
Maybe our,
I don't know.
no, I want to say GI.
Yeah,
It's a GI illness.
Undercooked pork.
Pork.
Yeah.
Which one?
Uncooked
what is
pork?
it?
Undercooked.
Really?
Yeah,
Which one is
yes.
on there?
Yersiniosis.
Yersiniosis.
Good
That's
question.
a new one, I guess. I haven't
Yeah.
run across that one before. So.
Right?
Okay.
And only one Lyme disease?
Yes. But there will be more
I
in the
suppose
next.
more June or July.
Yeah. I know it's surprising, right?
Yeah, because
Yeah,
I have a lot of patients with Lyme, but maybe they live in Brown County or that part.
Outside of the jurisdiction. Yes, and you will see more cases in the next quarter.
Oh.
Like a traveler's diarrhea or something. Is it ver or year? Because
Year.
Yersiniosis.
Yersiniosis.
Okay.
Yersiniosis.
Any other questions?
Any other questions? Okay. Program environmental health report.
Yes, so Trista prepared this report for you all. She did complete her licensure for establishments. We did note that we all saw the increase in tourist rooming house licensure for the draft, and this new license year, 15 of those did not renew. But you'll see in the numbers, we're still double where we were before the draft. So I don't know if those who are licensed want to see if maybe the Packer games, or maybe they want to kind of see how this next license year goes. And then we may see more drop off going forward, just depending on, if they have their establishments rented or not. So she is working with developmental services to identify unlicensed short-term rentals, and they do outreach with letters, and if they're not interested in licensing, then cease and desist, like they have to take the properties off of the Airbnb and other of those rental companies. So she has been busy doing that. And then in June, with your approval and City Council's approval, we have a new intergovernmental agreement with Brown County Public Health, so that the fairgrounds are now covered for agent program inspections through Brown County Public Health. And that was something that I think was really important for her volume and her workload, as well as the mere fact that although it's in the city limits, it is on county property. And so that was something that we had been doing for years, even in my first term, but I think it was time that, and with Anna's support, we had that conversation, and she was so willing to help us, understanding, the situation with our staffing. So I just want to say a public thank you to Anna, Nick with Brown County Public Health for signing and getting that agreement through the channels at the county to make that happen, because it really has helped Trista in her workload. And then we talk about Katie and her help with the inspections.
How'd you like doing the inspections, Katie?
They're good.
So you can't sit back there and be quiet all the time. Okay. Second and last item, program performance dashboard.
Right. So this is quarter
Are you
two.
getting hoarse yet from talking?
Yeah, almost.
okay.
I do have water here, though. Quarter two dashboard results are available for your review. I would say, the thing that we'll be monitoring this time around is, of course, our influenza uptake. We do have a quantity number that we'd like to hit based on previous years. And I'm telling you, I don't know if we're going to hit that. We're trying new partnerships. We're trying new programming efforts with, like the Mulva Cultural Center is an example, just to see if we can engage the community and offer these vaccinations for the community in different venues. But this year, we will only be able to give to vaccine-eligible children. Before, we did ask for a special supply that we could do mass clinic exercises and not have to screen out insurance, but that is not an option this year for us. And so we will need to screen out vaccine for children-eligible children. And so that's going to affect our numbers. We are offering a private pay stock when we are out and about in the community, but then the receipts need to be submitted to their insurance company and reimbursed, and so that may look a little different this year. Just wanted to give you a heads up on that.
Any other questions regarding the dashboard?
No.
Okay. There's always a chance for future agenda items, so talk to Crystal about that if you've got any other ideas. Anything else? Good of the group. Chris, thank you very much for coming.
Yep.
Thank you.
Thank you.
Katie, I appreciate you coming as well and seeing a face to a name. And how long is your tenure going to be here?
I'm not sure yet.
Not sure yet. Well, welcome here as well, and thank you very much for doing such a great job doing a variety of things here with the Pere Health Department.
Yes.
They'll have you all oriented by the time they hire you.
Right. Wouldn't that be nice?
So with that, I'd like to adjourn the meeting. Can I have a motion for adjournment?
So moved?
A second?
I'll second.
Okay, any discussion? Hearing none, all in favor say aye.
Aye.
Aye, opposed? Okay, motion passes. We are now disbanded.